The treatment landscape for metastatic urothelial cancer patients who are not fit to receive cisplatin-based chemotherapies has evolved over the last several years. In 2017, single-agent Pembrolizumab and Atezolizumab were approved in this setting. However, later on, their use was restricted to only patients with tumors harboring high PD-L1, and now further restricted use of Pembrolizumab to only patients who are not eligible to receive carboplatin. So we wanted to see if there's any biomarkers that can help us characterize which patients may respond better to carboplatin-based chemotherapy versus immunotherapy. And that's the real-world study that we undertook, in which the de-identified Flatiron Foundation Medicine clinical genomic database was utilized. And between 2011 and 2021, we had around 280 US cancer clinics with 800 sites of care and obtained their electronic medical records. We found that in patients who had tumor mutational burden 10 or higher, the progression-free survival and the overall survival, as well as time to next treatment, was higher with immune checkpoint inhibitors compared to those with tumor mutational burden less than 10. And we also compared in this database the patients who got chemotherapy based on the treating physician discretion versus immunotherapy. We found that in patients who had a higher tumor mutational burden, the progression-free survival favored single-agent immunotherapy compared to chemotherapy. And that was also true for time to next treatment as well as overall survival. Notably, for patients who had tumor mutational burden less than 10, chemotherapy had favorable progression-free survival and also time to next treatment. And while this is a real-world study, this is a very robust analysis, and this provides us insights which are also consistent with what was seen in the DANUBE and the IMvigor130 trials, where high tumor mutational burden was predicting better outcomes. However, that was not studied as a pre-specified criteria, and those were ad hoc analyses. And from this study, it is encouraging to see that tumor mutational burden is panning out to be a good biomarker as compared to PD-L1, which has not shown utility. So future studies are needed to validate this finding and probably stratify patients based on tumor mutational burden in urothelial cancer.